bone, and in the pelvic bone, this is acetabulum. It is a deep socket where the head of the femur will articulate. Now, this side actually, this is the iliac fossa, and this is the auricular surface, and it will articulate with the sacrum. So here is the iliac crest, like this is iliac crest. Now, greater sciatic notch, this big notch here is the greater sciatic notch, and this is the anterior superior iliac spine. And what we have, okay, so this bone actually, this big bone here is the ilium, this bone here is the ischium, and this bone here is considered the pubis. So ilium, ischium, and this is the pubis. So in the ilium we talked about acetabulum. This is the acetabulum. This is the iliac fossa. This is the iliac crest. This is the auricular surface. This is the greater sciatic notch, and this is the anterior superior iliac spine. Now we will move to the ischium. In the ischium, this is the ischial spine here. And ischial tuberosity is, this is the ischial tuberosity. Ischial tuberosity is this rough part. On the ischial tuberosity we sit. Now, this bone here is the pubic bone, and in the pubic, like this big hole we are seeing, this is the obturator foramen, and this is here. It will join with another pelvic bone, and that is known as pubic symphysis here. We will have a pad of fibrocartilage that will join another pelvic bone here. Now we will move to the femur. So this is the femur. This is the ball-shaped structure, is the head of the femur, and this small depression, this is the fovea capitis. Neck of femur, greater trochanter of femur, and lesser trochanter. This line here is the intertrochanteric line. So this is the anterior, okay. Now again we will go here. Like the head of the femur, greater trochanter, lesser trochanter, and this is the intertrochanter line here. We go down, this is the patellar surface. This is the patellar surface actually. So this one we were on the anterior side. Now we will go on the posterior side. When we go on the posterior side, head of the femur, neck of the femur, greater trochanter, lesser trochanter, and in between this is the intertrochanteric crest, and this is actually trochanteric fossa. This one here is the trochanteric fossa, and then here this is the medial condyle, and this is the lateral condyle of femur. So medial condyle of femur towards the head side, lateral condyle towards the opposite side, and this fossa here between the medial and the lateral condyle is the intercondylar fossa. This outer part is the medial epicondyle, and this outer part here is the lateral epicondyle. So medial epicondyle, this part here is known as adductor tubercle. Towards the medial epicondyle, just above it, that is the adductor tubercle. So we are done with the femur. Now this is tibia. The tibia, this bump is known as tibial tuberosity. Now, this one actually, here is the medial condyle and here is the lateral condyle. If we go all the way down, this is the medial malleolus. This is medial malleolus, and on the top actually, this is the medial condyle. This is the actually articular surface for medial condyle of femur. This is the lateral articular surface for the lateral condyle of femur. This is the intercondylar amnions. Between the two is the intercondylar amnions. And in the tibia actually, if we look at this is the medial malleolus, and this one here is the articular surface, and it will articulate with the talus actually. So that was the tibia. Now this is fibula, and in the fibula, this is the head of the fibula, and this is the lateral malleolus of fibula. So fibula is a thin bone, and head of the fibula and the lateral malleolus of fibula. Now we will cover the foot. So here is the foot. This is considered the heel bone or the calcaneus. This is the talus. Then we have, these are other tarsal bones like calcaneus, talus. Above the calcaneus, this is the cuboid. And above the talus, this is the navicular. Now we have three cuneiforms. This is the middle cuneiform, this is the intermediate cuneiform, and this is the lateral cuneiform. So how to find the middle cuneiform? This is actually big toe. So because big toe is towards the medial side, so this is the medial cuneiform, intermediate cuneiform, and the lateral cuneiform. These are the metatarsals. And below the big toe, this is the metatarsal 1, metatarsal 2, metatarsal 3, metatarsal 4, and metatarsal 5. Then phalanges. The big toe has the proximal phalanx and the distal phalanx, whereas other fingers has the proximal, medial, and the distal. So now we are done with